Tonight, a luxury cruise vacation has turned into an international health emergency. Passengers from the United States and Canada are now facing quarantine, medical monitoring, and uncertainty after a deadly hantavirus outbreak aboard the cruise ship MV Hondius. Health officials across several countries are racing to contain the situation after multiple infections and deaths were linked to the ship. So what exactly happened on board? How dangerous is the virus? And what comes next for the evacuated passengers? Here's the full story. The Dutch-operated expedition cruise ship MV Hondius was traveling across the Atlantic after departing from Argentina earlier this year. The voyage included passengers and crew from several countries, including the United States, Canada, the United Kingdom, France, Germany, and Spain. But during the journey, several people reportedly became seriously ill. According to international health officials, some passengers began showing symptoms linked to hantavirus, a rare but potentially deadly disease usually connected to rodents. The situation quickly escalated. At least 3 people linked to the outbreak reportedly died, while multiple others tested positive or showed suspected symptoms. The World Health Organization later confirmed several hantavirus cases connected to the ship. What makes this outbreak especially concerning is the strain involved. Officials believe some cases may involve the Andes strain of hantavirus. Unlike most hantavirus infections, the Andes strain can sometimes spread from person to person through prolonged close contact. That type of transmission is considered extremely rare. Health experts say the overall public risk remains low, but authorities are taking no chances. Passengers were isolated aboard the ship while emergency response teams coordinated evacuation plans. The vessel spent days near Cape Verde before eventually heading toward Tenerife in Spain's Canary Islands. Once the ship reached Tenerife, authorities launched a carefully controlled evacuation operation. Passengers were reportedly grouped by nationality and transferred directly from the ship to secure transportation. Special government flights were arranged by multiple countries. The United States organized emergency repatriation flights for American citizens. Canada and several European nations also coordinated evacuation procedures for their citizens. Spanish authorities emphasized that passengers would have minimal contact with the public during the transfer process. Medical teams wearing protective equipment monitored passengers throughout the operation. For American passengers, the next phase involves medical monitoring and quarantine procedures. According to U.S. health officials, several American passengers were transported to specialized medical facilities in Nebraska. The University of Nebraska Medical Center, home to one of America's national quarantine units, is now monitoring exposed passengers. One passenger reportedly tested positive for the Andes strain with mild symptoms. Others are being evaluated based on their level of exposure. Officials say some passengers may eventually return home under local health monitoring programs, while higher-risk individuals could remain in medical observation for longer periods. The monitoring period may last up to 42 days. Health authorities say the virus requires prolonged close contact for transmission, and they continue to insist the overall risk to the general public remains low. Canadian passengers are also undergoing strict health procedures. Reports indicate that Canadian citizens evacuated from the ship are being medically assessed and transported under government supervision. Canadian health agencies are coordinating with international officials to track possible exposures. Authorities are expected to continue monitoring passengers for symptoms during the coming weeks. Public health teams are also conducting contact tracing to identify anyone who may have had close interaction with infected passengers during travel. So what exactly is hantavirus? Hantavirus is a rare disease usually spread through contact with infected rodent urine, droppings, or saliva. Symptoms can begin with fever, fatigue, muscle aches, headaches, and breathing problems. In severe cases, the infection can lead to dangerous lung complications. Doctors say early treatment and monitoring are critical. There is currently no widely available vaccine specifically for hantavirus. However, experts stress that this outbreak should not cause panic. Health officials continue to repeat that widespread public transmission is considered unlikely. The outbreak has now triggered an international public health response. The World Health Organization, the U.S. Centers for Disease Control and Prevention, European health agencies, and local governments are all involved in tracking the situation. Airports, hospitals, and health departments are coordinating to monitor travelers connected to the ship. Several countries have issued medical advisories for healthcare workers to remain alert for symptoms connected to hantavirus exposure. Meanwhile, investigators are still trying to determine exactly how the outbreak started and whether any additional cases may emerge. For now, evacuated passengers from the MV Hondius face weeks of medical observation and uncertainty. While officials continue to emphasize that the overall risk to the public remains low, the outbreak has become a major reminder of how quickly health emergencies can spread across international borders. Authorities say the coming weeks will be critical as doctors monitor passengers for symptoms and continue investigating the source of the outbreak. We'll continue following this developing story and bring you the latest updates as more information becomes available. I'm your host, and this is World Pulse News. Thanks for watching. If you found this report informative, don't forget to like, subscribe, and turn on notifications for more breaking international news updates. Stay safe, and we'll see you in the next report.